Hi, my name is Garey Noritz, and on behalf of my co-authors, I'd like to thank you for viewing this podcast and to the editors of Developmental Medicine and Child Neurology for allowing us to share our work with you today, which was entitled Learn from Every Patient, Implementation and Early Results of a Learning Health System, which we performed here at Nationwide Children's Hospital and the Ohio State University Department of Paediatrics. When I arrived at Nationwide Children's Hospital 5 years ago, my predecessor, Amy Newmeyer, who is a co-author on the paper, had already begun the comprehensive cerebral palsy program here, and she had envisioned this as a learning health system in which children are provided state-of-the-art, evidence-based care, standardized, and then the data from those clinic visits is pushed into a data mart. And from that data mart, we're able to perform both translational research, creating new knowledge around the care of patients with cerebral palsy, and quality improvement projects to make sure that we're delivering that care as efficiently and effectively as possible. And from there, we come back and hopefully improve the evidence base and the standardized care that we are giving the patients with cerebral palsy. This learning health system is something that's been called for many years. It happens that we created it in a cerebral palsy program. It's the kind of thing that really could be applied to many different kinds of clinical programs. At the crux of it is that we do standardized data entry while in clinic. And so while we're seeing patients, we're entering data in a discrete fashion into the electronic medical record, which is then available for the research and quality improvement initiatives. So I want to walk you through what a simulated patient visit looks like. Using our electronic medical record, which is EPIC, we created these flow sheets. And during the clinic visit, we have a spot here where we can talk to the family and discuss all of their concerns and questions that they have. And there's a place here to write all of that free text. But then we have all of this other information captured discreetly, like etiology of the cerebral palsy, pattern of cerebral palsy, associated diagnoses with the cerebral palsy. And this is then available for the research endeavor. But at the same time, it's pulled directly into the clinic note, which is written in prose English and is the kind of note that we send to the referring provider, the primary care doctor, the other specialists involved, the school, and the family. And you can see that the parts in blue are what's pulled in from that flow sheet. When we implemented this in our clinic, we were able to increase the number of patients that we saw during a typical clinic session and, in fact, add a second clinic. And that was because the overall time the patients were spending in our large interdisciplinary clinic was decreased over time. Of the providers, the doctors and therapists that see patients in our clinic, 10 out of 11 said that they thought that capturing the data in this way for their clinical note made their documentation both faster and easier. The 11th person reported that it took about the same amount of time. The initial cost of doing this was less than $50,000, and we believe this was money well spent. We also instituted a proactive care coordination system with the nurses and social workers in our clinic to make sure that the patients were getting the care that we were delivering to them. And in the first year that we implemented this program, among the first 131 children that we served, we observed a reduction in total health care charges of $1.37 million, or a little bit more than $10,000 per child. We observed greatly decreased emergency room visits, inpatient stays in the hospital, and total charges. And I'd be happy if you were able to take a look at our paper and see some of the detail about how we looked at this in comparison to two different control groups, and also how we were able to use the knowledge that we gained from these clinic visits to publish manuscripts about our children with cerebral palsy, and then turn that new knowledge back into our clinic to improve the care that we are giving. This then led us to become part of the CP Research Network, which is a multi-institutional endeavor across the United States and Canada, in which we are hoping to link the electronic medical records to pull data from all of these different centers to get even more powerful data in which to improve the care of children and adults with cerebral palsy. And I encourage you to take a look at their website for more detail. I would like to acknowledge that Learn from Every Patient, the initial funding was provided by the Muse Family Foundation and the Pedal with Pete Foundation, both here in Columbus. So I hope you have a chance to review our paper, and I and my co-authors are happy to take any questions or comments that you may have about it. Please email us, and we thank you for your time.